Dr. Dar is here this morning with us from the Medical Center, and he's going to enlighten us with maybe some words of wisdom and what's going on in the Medical Center these days. Welcome, Dr. Dar.
Thank you. Thank you. Good morning.
So what's going on in the Medical Center?
Well, Medical Center is doing great.
Okay.
It's, it's growing, and patients are coming up, and they are getting better.
Good.
And the services are increasing. We have cardiology, we added dentist department recently, we have a podiatrist, we have physicians, nurse practitioners, and all types of facilities which you expect from a medical center, including vaccinations, which is a good thing, and small intensive interventions like nebulizer treatments. So we are doing good.
That's good. And what words of wisdom can you share with us today?
There's no word of wisdom, but I think everybody knows this wisdom. I wanted to talk to you and share with my residents about going to the emergency room.
Going to what?
Emergency room.
Emergency room.
Emergency room. You know, as the word emergency room means that you have to be there only if you have some emergency.
Right.
And it's very important to differentiate between emergency and a non-emergency. What is happening that a lot of people goes there. I was recently doing some literature search and find out that 70% of the ER visit are mostly non-emergency.
Right.
And one of the insurance company in New York, they checked out their data and they found out that out of 10 patients, 9 patients were non-emergency. So first of all, if you go to the hospital, you expose yourself to wider risk of infections, wider risks of problems.
Right.
Number one. Number two is it's an extra fruitful effort because you will go there, wait for 6 or 7 hours, and then you will come back with the same medications which you can get easily by talking to the doctor on the telephone or calling the medical center at home.
I know we used to, where I used to live, they kept saying, an emergency is not an ingrown toenail.
Yes, yes, yes.
It may hurt, but it's not an emergency.
Absolutely, absolutely. And you know, the cost of care, healthcare is rising.
Yes.
And if you go to the hospital, emergency room, the cost of care will continue to rise.
Right.
So this is a mutual, social civic responsibility to use the facilities which are more appropriate for us. It doesn't mean in any way that we should not go to the emergency room. Whenever we need to go to the emergency room, we have to be there because then you are in trouble.
Do the first responders here in Green Spring, when someone, say, pulls the cord at night,
yes,
how well equipped are they to take care of people instead of sending them to the emergency room?
You know, they are not medical patient people, but they know how to triage the patient, and they have been told to communicate with the doctor immediately if there is anything going on. First of all, if there is any problem, you can call the medical center during the hours.
During hours.
During hours. After hours, there is a doctor on call available, so you can communicate with them. I'm not
sure most people realize that there's always a doctor on call.
There is always a doctor on call, and it's a telephone call away. We all carry our cell phones. It's not a pager that you have to wait and we'll call back.
Right.
Our phone rings at home or wherever we are, and we have to answer that, and it's directly makes us in contact with the patient. So if you call the doctor, he will be available, and most of the time he will save you from going to the hospital. And the second thing is that he has, more insight to make a decision whether you need to go through the ambulance or a non-emergency vehicle. If you go through the ambulance, unfortunately, they are going to charge you probably around $900 per visit, and it ultimately comes from your pocket, co-payment. So I think you can save that. I would like to save mine. And the thing is, what is emergency and what is not emergency? For example, if you have headache, mild headache, you have runny nose, nasal congestion, you have mild cough, abdominal pain, you are feeling tired, fatigue, just call the doctor and we will be able to help you.
Now that would not necessarily be the doctor you normally see.
Yes.
It would be
on-call doctor.
Whoever's on call.
Yes, yes. And he will be able to help you. But if you fall down, if you have a bruise or a bleeding, or you notice that you have a cut on your hand, or you think that there is a fracture, if you have an unusual chest pain which you usually don't get, if you get really short of breath, unable to breathe, or if you have bleeding in the urine, then even in the blood in the urine doesn't make you go to the hospital all the time, but at least call the doctor. And these are the things which needs to be treated in the hospital.
Now, should they call the doctor first or call for the EMTs?
I think the first thing to do is to pull the cord, and the security and first responders will come to you and they will evaluate you, and they are instructed to communicate with the doctor.
Okay.
And it is always advisable that if a patient has some concern, it's better to talk to the doctor before you make your own decision. Know that, I am too sick, I have to go to the emergency room. Maybe, we can manage everything here and prevent a hospital visit and prevent 8-9 hours of your sleep.
Right, right.
So it's better to call. Doctor, either if he decides that you do not need to go to the emergency room, then either he will ask you to do something which is available locally, or otherwise he will advise you to come to the medical center tomorrow. And we will try to accommodate you immediately. A lot of the times, the medicine practice is a little bit different from all other professions. Here it depends upon the priority. Who needs to be seen first depends on what are his symptoms. If somebody is having a heart attack and somebody is having itching, then definitely we will see the person who is having a heart attack. And it is in the interest of all of us. We will save a life, and I am sure that the other person will realize that my itching is not important. The more important thing is so we sometimes it's hard to accommodate everybody because of these reasons. There are a lot of patients who needs immediate attention. But we try to accommodate. If we ask you that you don't need to be seen today, then you should not be worried. You should be very happy, that I am not sick. Doctor said I don't want to be seen. A lot of patients come to my office and ask for testing and all those things, and then I discuss the test or MRI or CAT scan, and when I tell them, everything is fine, they said, everything is fine? There is nothing? There should be something. I said, do you want me to find out something?
Well, they feel bad. They want to know something you can fix.
So I think it's always better to be healthy. And if you need to be healthy, then probably avoiding emergency room is a good thing.
It's a good thing.
I don't want to go to emergency room. I'm very. If I go there, I will be very worried. So it's better.
A lot of germs floating around in the emergency room.
lot of germs, and there are even different bacteria. For example, the pneumonia you get in the community is different and the treatment is different, and the pneumonia which you get in the hospital, the bacteria are different. They are more dangerous because first of all, they are not commonly available in the community. Second thing is, most of those bacteria are resistant to antibiotics. So nobody wants to expose to the bacteria which has no treatment at all.
Right.
So if we keep on going to the hospital, we are exposing ourselves to all these type of risks.
Exactly.
Yes. So my advice is that if you have any problem, pull the cord, first responders, talk to them and tell them that, you know, I don't feel comfortable, I need to talk to the doctor. And if they decide that you need to go to the hospital, and if you think that really I need to go to the hospital, even then it's advisable to talk to the doctor.
Right.
Yes. And if sometimes, you know, they are instructed that they have to call 911 immediately if somebody is suspected to having a heart attack or coughing up blood or vomiting blood, and that situation, we don't want to waste time between emergency room and your health.
Right, right. So there is a place for that emergency room.
Yes, there is a place for that.
But don't misuse it.
Don't misuse it.
Right, okay. Thank you so much, Dr. Dar.